Hey Centra, thanks for tuning in. Today we are going to talk about the Dependent Eligibility Verification, also known as the DEV. And we want to give you lots of education around this process that is coming up. It will affect a lot of our caregivers. And so today I have with me Amy Martin, who is our Total Rewards Director here in HR. She is our resident Dependent Eligibility Verification. Say that 3 times really fast. But she is our resident expert, and she's going to answer some really important questions for us today surrounding this process. So Amy, welcome.
Thank you.
Thanks for joining me. I think the very first question probably all of us have is, what is a Dependent Eligibility Verification?
So a dependent eligibility verification is a mouthful, and it's also a process that Centra uses to verify that the dependents who are covered on our caregiver health plans are eligible, qualified dependents.
Okay, so if I am not covered under a Centra health plan, or if I have no dependents on my health plan, I assume it's right to say that this process does not apply to me.
That's absolutely correct. And at this point, you can tune out unless you can help your friends. But if you're a caregiver here and you don't have, you're not on a plan, a Centra health plan, or if you are employee only health care coverage, which also means medical, vision, and dental, then this project does not apply to you. So we are really speaking today to our caregivers who have dependents on any of those 3 health plans.
Okay. So we now know what the DEV is, but why are we doing this?
Right, great question. So why are we doing this now? So this is another way, another process for Centra to be really good stewards of our resources. And so this is a standard for the industry. It happens every day across the nation in all types of industries and companies. And this, again, is simply a way for Centra, the provider of those healthcare plans, to confirm that our caregivers are covering dependents who are appropriate dependents and who are defined dependents by our benefits policies. And so our intent here is to clarify that we don't have dependents on our plan who aren't supposed to be on the plan. And this also is an opportunity for us to just make sure that we have the surcharge in place. And so if you have a spouse who has access to a healthcare plan somewhere else, they are supposed to be paying a surcharge. And so on the off chance that isn't occurring, this would flesh that out as well. So again, it's a way for us to be really fiscally minded and to make sure that we are good stewards of our resources.
Yeah, and this really taps into our foundational 5 and using data to drive financial vitality for us.
Absolutely.
And so this is just a really good process for us to go through, that we're kind of doing what we say we stand for, and we're reinforcing our foundational 5. So we know what it is, we know why we're doing it. Let's talk about who is going to take care of this process for us. Do we contact HR for everything, or who's doing this?
Okay, so you don't contact HR for everything, but of course we are here as always to support you and to help you get through any questions you have about benefits. We have partnered with a company called Consova, and Consova is a national company that is an expert in all things DEV, and they handle DEVs for companies across the nation. So all correspondence will come from Consova. In fact, the first correspondence that you'll receive is going to be the week of February 10th, and that will come in a Centra logo envelope. Please open it and read it. Don't just chunk it in your junk mail folder. Just take a minute to open that and read it. There will be very clear step-by-step instructions, again repeating a lot of some of the things that I've said, explaining what it is, explaining why we're doing it, the intent of this project, and then really clear instructions.
Mhm.
And so Consova will then at that point continue with more correspondence that will go straight from Consova to your home. And so if you have a minute, make sure that your address is correct in Oracle,
Mhm.
that you have verified that,
Mhm.
because it will go to the address of record. And there will be requests in there that say things like, hey, caregiver, you have your 2 sons and a daughter covered,
Mhm.
and we just need to verify that they are, in fact, your 2 sons and a daughter. And so they may ask for a birth certificate or a marriage certificate, and they will help you through every step of this.
So I can look in the mail in my home at my home address, and I don't need to so caregivers don't send anything to HR. This is completely done and taken care of by Consova. They are our partners in this. And so look in your home mailbox starting around February 10th, and just follow the directions. Of course, your HR partners are always here if you have questions, but certainly Consova, you can ask them questions. They will continue to send information as the audit or as the verification goes on. And so I guess the last question, Amy, would be, say I'm a caregiver, I get this in the mail, and I either forget about it, or I feel like I just don't want to really participate in the process. I am not sure that I feel comfortable with it, or for whatever reason, that I don't stand behind it, so to speak. What would be the outcome to that? What would you say to those caregivers?
So first of all, this is not punitive in any way. Again, this is a process, and it's a standard process. And Centra has done these before, but it's been many years.
Mhm.
So it's just time to do this now. So a couple of things. If you get that letter and you're still a little fuzzy, please take it to your leader and let them help you. They are well versed on all things DEV. They know that this is occurring. They know details, and they can help walk you through the process. Again, always give HR a call if you have any questions. HR will not have access to anything you submit, any documents that you submit to Consova, and that's why we've chosen this vendor. Extremely reputable for confidentiality, that every bit of information is between our caregiver and Consova. No one at Centra touches that data, and so extremely confidential. And the second part of your question, so what we don't want to happen is that anyone would have an eligible dependent drop off of their plan simply because the caregiver chose not to read the letters or correspond with the required documentation that they have to submit to Consova. Don't want that at all. So this is about a 90-day process, and as many of us are procrastinators, if we get to that point where Consova says, hey, we still have a handful of people who have not responded, again, it is not our intent to drop anyone off of our healthcare plans. Consova will start to be a little more persistent with phone calls or more letters. We even may reach out and say, hey, we just need to make sure that you know this is going on, and just some gentle reminders that you do have to participate in this. It's not really optional, but it should be seamless and as easy as it can be.
Okay, great. All really good information for our caregivers. We hope that this has been educational for you, that you now kind of understand the process of what we're doing and why we're doing it and what's going to be required of you. Start digging through your file cabinets and things at home to make sure you can find your marriage certificate and find your birth certificates and those kinds of things. And just be looking in the mail after February 10th for a letter from Centra and also from Consova that will tell you more about the process. So Centra, thanks so much for tuning in today. Amy, thanks for joining me, and we hope you have a great week.